Hello all, today I am going to discuss about ultrasonography. An ultrasound scan, sometimes also called as sonogram or sonography, and it is a procedure that uses high frequency sound waves in order to create an image of parts of the inside of our body. This ultrasound scan can be used to monitor the fetus, to diagnose a condition, or to guide a surgeon during certain procedures. An ultrasound scan can be performed if the patient has pain, swelling, or other symptoms which requires an internal view of an organ. In this sonogram, we can visualize the bladder, brain in case of infants, eyes, gallbladder, kidneys, liver, ovaries, pancreas, spleen, thyroid, testicles, uterus, and blood vessels. The sonogram is the common procedure performed during the pregnancy which helps the view of the unborn child. Preparation for the ultrasound depends upon the area or organ that is being to be examined. The person may need to be on fasting for 8 to 12 hours before the ultrasound, especially if the abdomen is being to be examined, because the undigested food can block the sound waves and makes it difficult for the technician to get the clear picture. For examining the gallbladder, liver, pancreas or spleen, we may need to eat a fat-free meal in the evening before the test is to be performed, and then we need to fast until the procedure is being performed. However, we can continue to drink water and take any medication as per the doctor's advice. And for some examinations, we may be asked to drink lot of water and to hold urine so that bladder will be full, and it helps for better visualization of internal organs. However, it is very important to follow doctor's instructions and to notify the technician about any prescriptions of drugs and over-the-counter medications or any herbal supplements which we have taken before the scan. This ultrasound carries very minimal risk as it does not use any radiation. That's why this procedure is being preferred for examining the developing fetus during the pregnancy. And the procedure includes, we need to explain the procedure to the patient, and before the exam we need to provide patient with a hospital gown and help the patient to lie down on a bed or table with a section of the body to be exposed for the test. An ultrasound technician, also called as sonographer, will apply a special lubricating jelly onto the skin, and this jelly prevents friction, so they rub the ultrasound transducer onto the skin, and this jelly also helps to transmit the sound waves. The transducer sends high frequency sound waves through the body. The waves echo as they hit a dense object such as an organ or bone inside the body. These echoes are then reflected back into a computer. They form a picture that can be interpreted. Depending upon the area being examined, the position of the patient need to be changed. And after the procedure, the gel which is applied must be cleaned off from the skin. The entire procedure usually takes less than 30 minutes depending upon the area being examined. The person can go back to their normal activities after finishing the procedure. And after the exam, The physician will review the image and will check for any abnormalities and will provide with proper treatment. The sonogram need to be performed only to detect any abnormalities and to provide the patient with prompt treatment. Fetal sex determination is illegal. So, say no to sex determination and save girl child.